Hello, today we are going to discuss the important topic of hearing diagnosis in children in the first year of life. Today we offer the short latency auditory evoked potentials, ABR technique, to measure the hearing thresholds even in very young patients. It is necessary to further use of this data for fine-tuning of hearing devices. In the future, this will help to ensure the age-appropriate speech development of a child. In young children, ABR recording should be performed in a state of natural sleep or under sedation, because short-latency auditory evoked potentials are very low-amplitude responses from the subcortical structures of the brain. To separate these signals from the background EEG noise, special conditions must be created under which any motor activity is minimized, even limb and eye movements. Parents should be told that the child must be prepared for the examination. Usually, the child should be woken up on the day of the examination, 2 hours earlier than the usual time of rising. The examination should preferably be carried out during the usual daytime sleep. Take with you a bottle, a blanket, a pillow, or anything, especially the ones the baby likes to sleep with. To ensure a comfortable environment for the child, ABR is best recorded in a specially equipped room with blackout curtains and noise insulation. In the room, the skin of the baby is prepared for the examination. We take a special abrasive paste and rub the skin in the places where the electrodes are applied until the skin is slightly red. It is necessary to achieve the lowest impedance, less than 5 ohm, ideally from 1 to 3 ohm. The lowest impedance provides the better quality of recording. The electrodes are placed on the mastoid and forehead. The upper electrode is placed on the border of the scalp and forehead. The lower electrode is placed closer to the bridge of the nose. It is important that there is a distance between the electrodes so that they do not touch each other. The baby is asleep, and we insert the earphones into the ear canals. We insert the blue cable in the left ear and the red cable in the right ear. Then, using the alligator clips, we apply the electrodes to the ends of the hydrogel electrodes. The first channel, the minus to the left mastoid, and the second channel, the minus to the right mastoid, the ground is connected to the lower electrode near the bridge of the nose. The plus is attached through Y adapter to the upper electrode on the border with the scalp. Now everything is ready, the baby is asleep, the electrodes are connected, and the earphones are inserted. Let's start the program. We select the required 2-channel ABR test and check the impedance. Pay attention to the color of indicators, it should be green. Make sure that the impedance is less than 5 ohm. The recording is started. At least 2 curves for each intensity should be recorded to compare them to each other and make sure that the peaks match. Only in this case we can be sure that the recording is correct. Then the peaks are arranged. The estimated time intervals of peak occurrence are shown on the graph by gray vertical bars. The time intervals depend on age, so it is very important to enter the child's exact date of birth. The intensity of stimulation should be reduced smoothly. First, the second peak disappears, then the first and third ones. The fifth peak disappears last. Usually the second and fourth peaks are determined well only at suprathreshold intensities. The task of the examination is to determine the minimum stimulus intensity at which the fifth peak, the hearing threshold, is detected. If necessary, the next ASSR test can be performed after determining the threshold of the fifth ABR peak. During this test, we can obtain the calculated audiogram and the hearing thresholds at 4 frequencies, which can be used for fine-tuning of hearing devices.